Hi, everyone. I'm Nidhi Madan. I'm a structural interventional cardiologist in Omaha, Nebraska, and I also work with the FiRST committee at the SCCT. We're here at SCCT2023, and I'm so happy to be joined by Dr. Todd Villines, who we would be speaking with, and my colleague from FiRST committee, Dr. Patricia Rodriguez Lozano, who is an advanced cardiac imager at the University of Virginia. And we would be talking to Dr. Villines today about role of artificial intelligence in cardiac imaging. Over to you, Patricia, to get us started.
Thank you, Nidhi. So it's my pleasure to introduce Dr. Todd Villines. He is the Chief Medical Officer in UC. He's also a professor in medicine, in the University of Virginia. And he's also a past president of SCCT. And thank you, Dr. Villines, for being here with us. And I'm going to start the conversation talking about what do you think is the role of AI guiding therapy for CID by CT?
Well, first off, thank you for having me. Just, what a wonderful meeting, and congratulations on all the things that the FiRST committee is doing. I think fundamentally, AI is going to change every aspect of cardiovascular imaging specifically, and obviously cardiovascular CT. And as far as guiding therapy, I think what we have seen at this meeting, and we see repeatedly in publications, is that it is allowing us to identify and quantify things that currently we're kind of leaving on the cutting room floor, meaning that we can see them, but we can't quantify them, and we're not then therefore able to translate that to patient care. And so I think, first and foremost, we've all talked about plaque and the ability to identify and quantify plaque and allow that then to serve as a benchmark as to whether patients are responding in therapy, for example, and to better quantify risk for patients. But I think as a field, taking it one step further from a systems levels where AI is really going to help us improve care. I mean, think about, again, this, all the things we're leaving and not acting on. Think about the thousands, even millions of non-gated chest CTs that are done in the United States. AI has the ability to, behind the scenes, identify that, quantify that, and then notify us that. So that not only goes in the report, but perhaps as a system, you can capture these patients, notify these patients, get them in to receive the preventive care that many times they're not aware of. I mean, I see in clinic so many times patients come in and they say, how could this event have happened? And you look back in time and there's plaque on CTs going 5, 6, 7 years that was either not reported or not translated to patient care. So I think that's just one example of how we can improve care. I think AI and the algorithms can help us generate patient-facing reports. We heard at this meeting that patients are now getting their CT reports before the referring physician. And so how do we translate that to them in layman's terms so that they can be engaged in their care in a better way?
So important. That is extremely important, the things that you highlight, Dr. Villines. And taking that a step further into the realm of structural interventions. I know the field itself is exploding with newer and newer technology coming every day. Where do you see the role of AI in structural interventions?
Well, if you think about, all of us who trained you doing CT to guide structural interventions, it's been highly manual. We were all taught, how to do planning for certain valve interventions, TAVR being the most. And I heard a statistic here at this meeting that if you look at the radiology field, there are 5,000 to 10,000 open positions projected over the next several years. AI has to allow our readers to do these complex evaluations in a much more efficient way. And so the ability to all of our volumes are growing. So the ability to do this very detailed work, what is a neo-LV alpha tract over a series of cardiac phases is one example. Sizing valve interventions, looking at suitability for repairs and transcatheter interventions. I think that requires detailed work, and AI will help us make that routine, make it reproducible, and allow us to grow our volumes to the levels that our patient care models demand. So that's the hope, and then hopefully it can actually improve outcomes ultimately, not just make us more efficient, but make us better.
So that, and also we have talked a lot about a big part of SCCT 2023 was AI. Do you think AI is the future of cardiovascular medicine?
I think all of us practicing imaging and cardiovascular medicine will all have to use AI. It is going to be impossible. It's going to be, I think, ingrained into all that we do. But I think it's important to remember that AI is just a tool, right? Just because you're using AI or you use it in a study doesn't mean that it's necessarily better. We still need to ensure that we understand the methodology. We understand and make sure that it's generalizable in the population, that people who are developing these AI algorithms, it has to go through the peer review test and have to be proven. But yes, I think that the solutions that are able to cross that gap and truly bring high quality care to patients, it will be a part of everything we do, as we talked about, from a systems level, at a patient level. I do think in the field of cardiovascular CT that, if you think about where we're going with things like photon counting CT, the amount of data we can generate from a single series now for photon counting CT is exponentially greater. We know it's an advancement. How do we do that in clinical care if you're doing 30, 40, 50 scans a day? We're going to need AI to help us. I think it's a prerequisite. We still have a lot of work to do as far as just ensuring I think consistency and how these algorithms are derived. I think we'll have to change over time to ensure that the data that we're getting from these AI algorithms are reproducible, repeatable, and we all can have confidence in the numbers we look at.
Those are extremely valuable things, and we have learned. We still have a lot of things to learn about AI as we move ahead. Now that we are at SCCT 2023, a couple of final questions for you. What do you think was your favorite part from SCCT 2023, the most favorite?
Well, on a personal level, this having the COVID years and then having missed last year's meeting in person due to COVID, just being able to see all of you here and to see the enthusiasm. This was the largest meeting that the SCCT has ever had. And so to see, everyone back in rooms together, interacting, as much as we all do virtual meetings, there's nothing that can replace this, this feeling of togetherness that we've seen at this meeting. So that first and foremost. But I think from a scientific perspective, I think this increasing appreciation for prevention, right? This is not a meeting just for people who do CTs or read CT scans. We are now, in the larger umbrella of the SCCT, now seeing so many preventive cardiologists realizing that what we do is directly tied to changes in patient management. And so the fact that we're seeing a growth in, the understanding of plaque and it's, using it to guide care, and seeing more interventional cardiologists so that plaque guides interventional care. And obviously the structural field, how can we leverage, things like CFD to assess even more than just FFR and looking at, congenital heart disease and structural disease. I think that's really exciting to me.
Yeah, I think all those things have been extremely important and people have been teaching us here at the SCCT 2023. So I hope we all got to learn something, and those of you out there, hopefully this was useful and you got something that you can utilize in your clinical practice. Thank you so much, Dr. Villines, for joining us today and sharing these thoughts about AI and cardiac imaging, as well as some takeaways from our meeting. Thank you.
Thank you for having me.